Good afternoon. I am here to announce one new case of COVID-19 in PEI today. It is a female in her 20s who traveled to PEI from within Atlantic Canada. She has mild symptoms and is self-isolating at home. Contact tracing is underway, and all close contacts will be tested and required to self-isolate for 14 days. The case and all close contacts will be followed daily by public health nursing. The close contacts that have been tested to date this morning are negative. Contact tracing and testing are ongoing, and more information will be available in the coming days. But there are public notifications associated with this case. Anyone who is at the Atlantic Superstore on 465 University Avenue in Charlottetown on Monday, November 23rd, between 3 and 4 p.m., should monitor themselves closely for symptoms of COVID-19 and be tested if any symptoms of COVID-19 develop. The Atlantic Superstore's mandatory mask policy certainly lowers the risk to their customers in this situation, and you do not need to be tested if you do not have symptoms. This individual was also at 2 Charlottetown restaurants. The first one is Gahan House in Charlottetown between the hours of 9 to 11, and the second is Terra Rosa between 7:30 and 9:30. Public health nursing will be using the sign-in sheets from these locations to identify the patrons who will be advised of a potential exposure to COVID-19. Again, individuals who need to be tested as a result of a potential exposure at these restaurants will be contacted directly by public health nursing. Also, staff at these restaurants will also be tested, and they will isolate at home until the results come back. So those who are working now are not any staff who were working at that time. And both of those times and those restaurants were on Saturday evening. We will know much more about the risk of transmission of COVID-19 in PEI related to this case within the next 48 hours. As I mentioned earlier this week, it is not surprising that we have a case related to a potential exposure within Atlantic Canada. This is not cause for alarm, but serves as a reminder of the need to adhere to the public health measures. These public health measures are effective in breaking the chain of transmission of COVID-19. I know we discussed these measures yesterday and at multiple times, but I'd like to reinforce them today. Increase hand washing and surface disinfection, maintaining a physical distance from people outside your household, and wear a mask when in public places. Keep your circle of contacts as small as possible, and if you develop symptoms of COVID-19, please get tested and self-isolate until your test results come back. Stay home from work and other events when you are not feeling well. And also a reminder from Nova Scotia, as issued by their public health officials on Monday, that anyone in PEI who was at a bar or restaurant, a licensed establishment in the Halifax Regional Municipality after 10 o'clock in the last 2 weeks, since November 10th, should be tested for COVID-19 even if they do not have symptoms. There is risk of exposure to COVID-19 in these settings, and out of an abundance of caution, would like to emphasize that all Islanders who were in any licensed establishment in the Halifax Regional Municipality since November 10th should be tested at one of our drop-in clinic testing sites. In order to improve access to testing, Health PEI will be expanding testing clinic hours across the province today. Both at Slemon Park in Summerside and Park Street here in Charlottetown, they will have their clinics open until 8 p.m. Also a note that anyone in PEI who traveled within Atlantic Canada between Monday, November 16th and Monday, November 23rd, just prior to the temporary suspension of the Atlantic travel bubble, needs to take extra precautions for the 14 days after returning to PEI. They must wear a non-medical mask at all times when outside their household, when they're in public, and pay extra attention to hand hygiene and physical distancing. They should monitor themselves closely for symptoms and be tested and self-isolate if any symptoms develop. Also, they should avoid organized activities including hockey, ringette, and house parties. They can attend work or school, but must adhere to enhanced public health measures and wear a mask at all times. We are all doing these extra precautions to protect ourselves, families, and our community. I'd also like to remind Islanders of the symptoms of COVID-19: new or worsening cough, shortness of breath or difficulty breathing, fever, chills, sore throat, and runny nose, sneezing, congestion, headache, muscle joint, body aches, feeling unwell or unusual tiredness, and acute loss of sense of smell or taste. Anyone who has symptoms that might be related to COVID-19 should go to a COVID-19 drop-in testing clinic to be tested. I also urge Islanders to download the COVID notification app. This national app is free of charge and alerts individuals to potential exposures before symptoms may occur. And that notification would happen, of course, as long as the case has downloaded the app themselves. I'd like to thank all Islanders for their continued care, concern, and cooperation. We've said it so many times, we will get through this, and we will get through it together. As we support one another through this pandemic, let us be patient and kind towards yourself and others. Thank you. And I'll open it up to questions really on what we've just talked about today, and I'm happy to take questions that are not directly to about what we talked about today at the next general briefing or through communications in email follow-up. So I'll open it up for questions.
Jenkins, The Guardian.
Yes, hello. I was wondering when the woman arrived on PEI. Perhaps you mentioned it. I missed it.
She arrived back on November the 13th.
Okay. Okay, thank you. And I think that's it. I was wondering if she should have been self-isolating, but she was coming from within the Atlantic bubble, and so she was not under any health order to self-isolate. Is that correct?
That is correct. And when she developed symptoms this week, she went for testing.
Okay, thank you very much.
You're welcome.
Rachel Collier, Eastern Graphic.
Hi, yeah, I was wondering if right now, as the restrictions stand, if somebody needs to go to New Brunswick or Nova Scotia for a medical appointment, or would they have to self-isolate when they return to PEI?
Hi, Rachel. So if someone is traveling for a medical appointment to New Brunswick or Nova Scotia and return within 24 hours, they do not need to self-isolate, but certainly information is on the website, and part of our advice is that you minimize your exposure, so you go directly to your medical appointment. You don't stop and shop along the way, and then you return. So if that's over and back for a medical appointment within a day, people do not have to self-isolate.
Okay, thanks for that clarification.
You're welcome.
Carrie Campbell, CBC.
Good afternoon. Thanks for the opportunity to ask some questions. I just wonder if you could talk a little bit more about the dates and the circumstances, because you say this person arrived here on the 13th, but the advisories that you're telling us about regarding where they were are coming about a week later. So I'm curious, first of all, if you're confident that the infection did in fact come from Nova Scotia and it wasn't picked up here on PEI. And then also just wondering, were there any other sort of outings for this person over that period where you might want to advise people about as well?
So Carrie, good questions. As we've done with all our other cases really from the beginning. And this is similar in other provinces. We go back 48 hours from the onset of symptoms, and we do all the testing of close contacts and go back 48 hours from symptoms, and at least as a starting point. So we know the closest contacts are the ones that you have the most exposure to over a prolonged period of time. They might be family members, for instance, and then of course we're including all public notifications that we've just talked about even before the person had symptoms. And if that raises any other concerns, we would continue. But that is certainly very much part of the contact tracing and the guidance around doing contact tracing. So and that has been very standard for us in the last 8-9 months now.
Okay, and I just wonder, can you tell us how many tests have been conducted as a result of this one case, and especially how many contacts do you have that you're trying to track down, and what is our capacity right now in terms of doing that contact tracing work?
So I spoke to the case this morning, and we were able to do some of the close contacts. I think there have been 3 close contacts that have been tested, and their results have already come back negative. I've spoken with the owners of both the restaurants, and they've provided a list of their patrons during a period of time. And so we have nurses that are reaching out to those patrons now and advising them also to be tested. So I don't have a total number, but I certainly will be able to have a good sense of those numbers in the next day, but we do have the list from both restaurants, and of course it's also trying to make sure. Partly today was to make sure that anyone who from Prince Edward Island who had been at any of the licensed establishments, restaurants or bars in Halifax from November 10th on goes to get tested whether or not they have symptoms. And that's really because of what's happening in Halifax, and we really want to make sure we can identify as quickly as possible any potential cases here in Prince Edward Island.
All right, thank you very much.
You're welcome.
Gabrielle Drummond, Radio-Canada.
Bonjour. Question en français pour la docteure Heather Morrison. Alors, docteur Morrison, les 2 lieux de possible exposition à la COVID-19 dont vous avez mentionné, ce sont des restaurants ici à l'île. On sait qu'à Halifax, on voit déjà la fermeture des restaurants là-bas. Est-ce que vous déconseillez les insulaires de fréquenter ce type d'établissement, de restaurants, au moins dans les 2 prochaines semaines?
Bonjour. À ce moment, c'est pas, et je ne sais pas si j'ai même dit ça en anglais, mais c'est pas une cause pour alarme. On vient de dire il y a quelques jours qu'on anticipe des cas ici. Et puis, on va voir qu'est-ce qui arrive. Mais à ce moment, c'est pas à propos de fermer les autres restos. C'est à propos de chercher pour les cas s'il y en a. Mais c'est vraiment les autres mesures. Porter les masques obligatoires maintenant, de laver les mains, de garder votre contact pas grand, le nombre de contacts soit petit, de continuer à faire ça au lieu de faire d'autres changements à propos des restos.
Mm-hmm. Parfait, excellent. Et une autre question, ça serait par rapport aux gens qui rendent visite à leur famille ici à l'île pour passer le temps des fêtes. Je sais que depuis la semaine passée, ces personnes qui veulent venir à l'île doivent soumettre un plan de voyage, un plan d'auto-isolement pour leur séjour ici à l'île. Alors, combien de demandes avez-vous reçues jusqu'à maintenant de la part de ces personnes qui veulent venir ici à l'île pour rendre visite à leur famille pour le temps des fêtes?
Je ne sais pas les numéros aujourd'hui, mais je suis content d'en chercher pour la prochaine temps pour la presse. Mais on peut donner le nombre de personnes qui ont fait l'application de Pre-Approval Travel pour la famille et pour compassion, pour travailler. On peut avoir ces numéros, mais je n'ai pas porté aujourd'hui.
OK, parfait. Excellent. Merci beaucoup.
Jessica Dorier-Brown, CBC.
Hi, Dr. Morrison. Just given the new areas of public exposure, just wanted to hear from you on how concerned islanders should be at this point about community spread.
Hi, Jessica. So I think I said, I think I said it in English, and I just said something similar in French. I don't think this is a cause for alarm, but it's what we mentioned earlier in the week that we would expect and wouldn't be surprised if we saw cases linked to other provinces. I think at this point in time, it's really a reminder to islanders to continue doing what we need to do from a public health measures point of view, and we'll know more certainly in the next couple days as we do increased testing of people who may have been out eating at licensed establishments in Halifax municipality, and also any potential contacts of our case here.
Okay, thank you. And just given we've got a case now from inside our broken bubble, are you expecting more from recent bubble travel?
Well, I wouldn't be surprised if we get some additional cases, and it's what certainly has, I think I said the other day, it is a concern. We have received a couple of additional interjurisdictional notifications of people who are here in Prince Edward Island who are close contacts of cases in our neighboring provinces, and that means that they are tested and they are followed up on a daily basis as well here by our public health nursing. So we'll continue to monitor and do what we've been doing for a number of months, trying to get our arms around these cases and limit any potential spread.
Okay, thank you very much.
You're welcome.
Laurent Rigaud, La Voix acadienne.
Oui, bonjour, docteur Maurice. J'avais une question sur la personne qui est donc revenue à l'île le 13 novembre. Le premier lieu d'exposition dont vous parlez, c'est le samedi qui suit. Ça veut dire que, en fait, pendant toute la semaine, elle n'est allée nulle part, cette personne. Il n'y a pas eu de contact dans d'autres lieux publics à Charlottetown.
Oui, et, bonjour. Et puis, je pense que j'ai essayé d'expliquer ça à Carrie de CBC en anglais, que quand quelqu'un a des symptômes, on va 48 heures au moins, on commence avec ça, avant que la personne a des symptômes. Alors, et puis on fait les contacts qui sont très proches. Alors, dans ce cas, elle a eu des contacts qui sont beaucoup de temps ensemble, avec peut-être la famille, et puis on fait ces contacts qui sont proches, et puis on va 48 heures avant les symptômes pour faire les notifications qui sont plutôt plus publiques. Et puis on va commencer avec ça et on va voir qu'est-ce qui arrive dans les prochains jours. Mais c'est la même sorte de choses qu'on a fait depuis mars. Alors, et puis d'autres provinces font la même sorte de choses.
Ok, merci. Je n'avais pas compris effectivement en anglais. Et une autre question, est-ce que vous pouvez répéter en français les lieux d'exposition à Charlottetown, les 3 lieux où il faut faire attention, s'il vous plaît?
Je vais essayer. Premier lieu est le Atlantic Superstore, University Avenue, c'est 465, entre 3 et 4 heures le 23 novembre, le lundi. Et puis aussi le samedi, c'est le 21, samedi le 21, Terra Rosa à Charlottetown, entre 7h30 et 9h30 à peu près. Et aussi Gahan House à Charlottetown, entre à peu près 9h jusqu'à 11h. Et puis, et c'est important que tous ces individus qui sont, la liste, les restos prennent la liste des personnes qui entrent, et puis ces personnes, on travaille avec les restos et on les listes et sont en train de faire les appels pour demander à ces personnes d'aller faire un test pour le COVID. Alors, ils sont en train de faire ça avec la santé publique à ce moment. Et puis aussi, les personnes qui travaillent au resto vont être testées s'ils travaillent le 21, le soir.
Merci beaucoup.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr Morrison. Dr Morrison, vous avez dit lundi, puis mardi, que toutes les personnes qui revenaient, par exemple, de la région d'Halifax, devaient porter le masque en tout temps, limiter leurs déplacements, limiter leurs contacts. Est-ce que maintenant ce conseil change et toutes les personnes qui ont visité la région d'Halifax doivent aller se faire tester le plus rapidement possible? Et si oui, est-ce que la province a la capacité pour faire tous ces tests?
Et puis, j'apprécie, parce que je vais être claire, qu'on demande que toutes les personnes ici, à l'île du Prince-Édouard, qui ont fréquenté les restos, les bars, à Halifax, la région de Halifax, la municipalité de Halifax, après le 10 novembre, doit aller se faire tester, même s'ils n'ont pas de symptômes. Et puis, oui, on a la capacité et c'est pour cette raison aussi on augmente les heures à Slemon Park et aussi à Charlottetown. Alors, Summerside et Charlottetown jusqu'à 8 heures ce soir. Et puis, j'imagine qu'ils vont avoir plus de tests demain aussi. J'imagine que ça va augmenter, mais je sais que remercie à Health PEI parce que les personnes qui font les tests et à laboratoire, c'est beaucoup de travail. Alors, we're thankful. I'm just saying in French, thankful to the lab and to the testers and the testing clinics who will be, and EMS who will be helping out, I believe, too, to extend those hours and to really deal with some increased testing. But we do have the capacity, and we're so thankful we're in that position at this time.
Dr Morrison, pour continuer, vous essayez de nous rassurer depuis plusieurs jours, mais est-ce que aujourd'hui l'île du Prince-Édouard n'a jamais été aussi proche d'une transmission communautaire que depuis le début de la pandémie?
Bonne question. Chaque fois qu'on a un cas ici à l'île du Prince-Édouard depuis le début, et chaque fois qu'on sait qu'il y a c'était difficile à auto-isoler ou qu'il y avait des contacts, je m'inquiète. Alors, je m'inquiète depuis très tôt ce matin, mais j'espère que toutes les autres mesures qu'on a mises en place vont nous garder en sécurité. Mais c'est différent parce que c'est la première fois qu'on a un cas qui voyage d'intérieur la boule, ou qui était la boule avant. Alors, on est en train d'être dans une pandémie globale et on fait tout ce qu'on peut ici à l'île du Prince-Édouard et les insulaires, fait tout ce qu'on peut pour faire notre mieux ici.
Merci beaucoup.
De rien. OK. Thank you all very much.